If you've been prescribed allopurinol, Zyloprim, for gout, high uric acid, or kidney stones, you might be wondering, how exactly does it work? What side effects should you watch for? And how can you make sure you're taking it safely and effectively? In this video, we'll break down everything you need to know about allopurinol, Zyloprim, from how it lowers uric acid, to the best ways to take it, potential side effects, and pharmacist-approved tips to help you get the most benefit from your treatment. Whether you're just starting allopurinol or have been taking it for a while, this science-backed guide will help you understand your medication clearly and use it with confidence. What is allopurinol, Zyloprim? Allopurinol, also known by its brand name Zyloprim, is a prescription medication classified as a xanthine oxidase inhibitor. It helps lower uric acid levels in the body, which is essential for managing and preventing gout in adults. In addition to treating gout, allopurinol, Zyloprim, is also used to prevent recurrent calcium oxalate kidney stones and reduce the risk of tumor lysis syndrome in patients receiving certain chemotherapy treatments for cancer. This medication is available as an oral tablet, often prescribed in its affordable generic form. Most people tolerate allopurinol, Zyloprim, well, but mild side effects such as diarrhea or nausea may occur. What is allopurinol, Zyloprim, used for? Healthcare providers commonly prescribe allopurinol, Zyloprim, for treating gout in adults, preventing tumor lysis syndrome in adults and children receiving chemotherapy for cancer, reducing the recurrence of calcium oxalate kidney stones in adults. How does allopurinol, Zyloprim, work? Allopurinol, Zyloprim, works by inhibiting an enzyme called xanthine oxidase, which is responsible for producing uric acid in the body. When uric acid levels become too high, crystals can form in the joints, leading to painful gout attacks, or accumulate in the kidneys, forming stones. By reducing the production of uric acid, allopurinol, Zyloprim, helps relieve and prevent painful gout flare-ups, protect joints from long-term damage, prevent the formation of kidney stones, lower the risk of complications from tumor lysis syndrome during chemotherapy. Allopurinol, Zyloprim, is most effective when taken regularly as prescribed, even when you're not experiencing symptoms. Consistent use helps maintain healthy uric acid levels and prevents future flare-ups or kidney stone formation. Side effects of allopurinol, Zyloprim. Like all prescription medications, allopurinol, Zyloprim, may cause side effects. Most are mild and temporary as your body adjusts to the medication. However, some reactions can be serious and require immediate medical attention. Always consult your healthcare provider if you experience any unusual or persistent symptoms. Common side effects. These side effects are generally mild and may improve over time. Diarrhea, nausea, elevated liver enzyme levels, rash. Other possible side effects. Some people may experience temporary increase in gout attacks during the first few weeks of treatment, headache, muscle or joint pain, nerve pain, such as tingling or numbness in the arms or legs, changes or loss in taste perception. Serious side effects. Contact your healthcare provider immediately if you notice any of the following symptoms: severe skin reaction, rash, hives, painful blisters, skin reddening or peeling, sore throat, fever, or swollen lymph nodes, severe allergic reaction, facial swelling, trouble breathing, or signs of anaphylaxis, such as throat tightening, liver problems, severe nausea or vomiting, pain on the right side of the abdomen, loss of appetite, fatigue, or yellowing of the skin or eyes, jaundice, low blood cell counts, fever, chills, weakness, difficulty breathing, unusual bruising or bleeding, or blood in urine or stool. If you experience a severe reaction, stop taking allopurinol, Zyloprim, and seek immediate medical help. Allopurinol, Zyloprim. Dosage forms and strengths. Allopurinol, Zyloprim, is available in oral tablet form, with several dosage options. The most commonly prescribed strengths are 100 mg, 200 mg, and 300 mg tablets. While prices vary depending on location and pharmacy, the average cost for 30 tablets of 100 mg allopurinol, Zyloprim, is approximately $4.80, which is about 46% lower than the average retail price. Generic forms are widely available and typically more affordable. Dosage quantity price, approx. Price per unit 100 mg 30 tablets $4.80 0.16200 mg 90 tablets $135.85 $1.51300 mg 90 tablets $16.31 0.18. Typical dosage for allopurinol, Zyloprim. The dosage of allopurinol, Zyloprim, depends on your medical condition, uric acid levels, and kidney function. It is usually taken once daily, but higher doses may be divided into smaller doses throughout the day to improve tolerance. 1. Gout. Typical starting dose, 100 mg by mouth once daily. The dose may be gradually increased to 200 to 600 mg per day, depending on response and uric acid levels. 2. High uric acid levels due to chemotherapy, tumor lysis syndrome. Adults, 300 to 800 mg per day by mouth. Treatment usually begins 1 to 2 days before chemotherapy and continues for 2 to 3 days afterward. Children, the dose is based on body size and given every 8 to 12 hours. Pediatric treatment also starts 1 to 2 days before chemotherapy and continues for 2 to 3 days afterward. 3. Recurrent calcium oxalate kidney stones. Typical dose, 200 to 300 mg per day by mouth. The maximum recommended daily dose of allopurinol, Zyloprim, is 800 mg. For best results, take allopurinol, Zyloprim, consistently as prescribed by your healthcare provider. Do not stop the medication without medical advice, even if your symptoms improve. Pharmacist tips for allopurinol, Zyloprim. To get the best results from allopurinol, Zyloprim, and minimize side effects, it's important to take this medication exactly as prescribed and follow your healthcare provider's guidance. 1. Monitor your uric acid levels. Schedule regular check-ins with your healthcare provider to track your uric acid levels and symptoms. Your dose of allopurinol, Zyloprim, may need adjustment over time to ensure it's effectively controlling your condition. 2. How to take allopurinol, Zyloprim. You can take allopurinol, Zyloprim, with or without food, but it's generally recommended to take it after meals to reduce stomach upset. Swallow the tablet with a full glass of water. 3. Possible drowsiness or dizziness. Allopurinol, Zyloprim, can cause sleepiness or dizziness in some people. Avoid driving, operating heavy machinery, or engaging in tasks that require full concentration until you know how the medication affects you. 4. Avoid alcohol. It's best to limit or avoid alcohol while taking allopurinol, Zyloprim. Alcohol can increase your risk of gout flare-ups and may worsen side effects like dizziness and drowsiness. 5. Stay well hydrated. Drink plenty of fluids, ideally at least 2 liters of water per day, to help your kidneys remove uric acid and prevent kidney stone formation. 6. Watch your diet. Discuss with your healthcare provider or a registered dietitian which foods to limit while taking allopurinol, Zyloprim. Certain foods high in purines, such as red meat, organ meats, and alcoholic beverages, can raise uric acid levels and trigger gout symptoms. 7. Check for drug interactions. Always tell your pharmacist or healthcare provider about all prescription drugs, over-the-counter medications, vitamins, and supplements you are taking. Allopurinol, Zyloprim, can interact with other medicines, and your care team can help you avoid harmful combinations. 8. Pregnancy and breastfeeding considerations. If you are pregnant, planning to become pregnant, or breastfeeding, speak with your healthcare provider before taking allopurinol, Zyloprim. The safety of allopurinol, Zyloprim, during pregnancy has not been clearly established. Allopurinol may pass into breast milk, so it's generally advised to avoid breastfeeding during treatment and for at least 1 week after your final dose. Your provider can help you evaluate the safest options for your situation. 9. Consistency matters. Take your medication at the same time each day. Skipping doses or stopping suddenly can cause uric acid levels to rise, increasing the risk of gout attacks or kidney stone formation. Allopurinol, Zyloprim, is a reliable and cost-effective medication for managing gout, reducing uric acid levels, and preventing kidney stones. With proper monitoring, hydration, and adherence to your doctor's advice, it can significantly improve long-term outcomes and quality of life. If you found this information helpful, don't forget to like this video, subscribe to the HeInfo channel, and turn on notifications for more expert, science-backed health explanations from trusted sources.